Hello, everybody. Today, my interview is with Claudia Garcia. I asked Claudia if I could interview her because she has an interesting perspective on drug diversion and substance abuse. Claudia's background is an OR nurse, and this is the arena that she practiced in until her life changed over the course of a few months, roughly 7 to 8 months. One of her colleagues had developed a substance abuse problem, and she found herself very often at the bedside with that colleague, a nurse anesthetist. The colleague was still a high performer, but started showing signs of depression, anxiety, becoming more disconnected from the team. Claudia, thank you for joining me today.
It's my
I
pleasure.
know I know it's an emotional topic, and I really appreciate you sharing with us. Give us some insight into what changes you started seeing and what was going through your mind. What were you attributing those behavioral changes to?
So in the beginning, it's hard because you're not always looking for addiction. So in the beginning, I just thought that maybe he was overworked. He was stressed out with the job because he does have a high demanding job, and there's a lot of stress, and there's a lot of just chaos sometimes in the OR. Sometimes we have emergency cases, sometimes we have unstable patients. So we were working in a hospital where a lot of our patients were sick. So oftentimes I thought the reasons why he was disconnecting and just being different, it was all related to the stress and just the demand of the job.
So, at any time, did you think it might be substance abuse, or was it the furthest thing from your mind, or did it take a while and maybe you started thinking that might be the case?
Well, in the beginning, I definitely did not even suspect that, and I think as a professional and as a nurse, you don't ever expect your colleagues to go through something like that. You don't think that they're going to develop an addiction or divert medications from the hospital or go to work impaired or anything like that. So it was the furthest thing from my mind, but I thought more, it was just, depression and anxiety. And it wasn't until, a few months where I started noticing some behavioral things where he was disconnecting. He wasn't eating lunch with the staff. He was just short and moody, and his whole personality had changed. And, my colleague was just a completely different person from what I knew him as to what he became. So it was just so apparent to everyone that something was going on. But again, I thought it was related to the job.
Sure. And you bring up a good point. I think, especially in procedural areas, but definitely on, medicine, nursing units, it is a cohesive team and you are a family. And that is the last thing that you want to think. And, I've observed in procedural areas before, and oftentimes the attitude is, well, we're a family. That's not going to happen. I don't need to watch that person for that. I trust them completely. So I hear what you're saying. Did you share your concerns with anybody, or did anybody share concerns with you, or did everybody just kind of keep their mouth shut and, inside they were wondering what is happening here?
Well, once I figured out that he was in trouble and he had an addiction problem, I didn't know what to do. I honestly didn't. My hands were tied. I have a unique perspective because not only was I his colleague and coworker, but I was also his partner. I was in a relationship with him, so it made it even harder for me to ask for help. So what I did is I confided in one of his colleagues, another CRNA, another nurse anesthetist, who I thought, well, maybe this person could help me. Maybe they know procedural wise. What do you do? Who do I call? Who do I tell? And the last thing I wanted was, of course, for a patient or anyone to get hurt, but I also didn't want to ruin his career, because what if I was wrong? Because there's always that possibility as well. So I did confide in another CRNA who I shared some of my suspicions and my concerns. And she also, in the beginning, she wasn't really sure. She said, I'm not really sure, but let me watch his behavior and let me just watch some of the stuff he's doing clinically. And after a few weeks, she came to me and said, I think you're right. I think something is going on. And we both tried we made our best attempt to try to get him help. I remember speaking to his director, and I even said, hey, something's going on with him. I didn't throw him under the bus, and because again, I didn't know exactly what was going on, but I did say, look, something's off with him. I'm concerned about his mental health. Can you do something? Maybe review his charts or have a chat with him, do something. And they did some chart audits, and they came back to me and said, you know what, he's fine. Maybe it's just stress and anxiety. So again, I made the attempt to try to get him help, but at the time I really didn't know who to call or what to do.
Okay, so that's interesting. Yes, what Claudia mentioned is that this was her husband, and so she was definitely closer to the event than just as a peer and as a colleague. That's nice that you had somebody that you could go to, another CRNA, to assist you, because at that point you knew something was off, but you wanted somebody else to kind of corroborate that and to make sure that you weren't crazy, right?
Sure.
Yeah, and you're seeing other, were you seeing things at home as well in addition to in the OR?
Yes, absolutely.
Yeah.
I would watch, just the same thing that I would see at work, I'd see it at home. He was disconnected. He was sleepy all the time. He was just short with everyone. He had very short fuse, which is not like him. He's a very happy, jolly guy, and he's very positive and very helpful. But when he starts getting snippy and moody, and, that was just not him. So I knew something was off, but those were the main things that I witnessed when he was at home, was just the disconnection, and just, isolation, and not wanting to be around the family and the kids and things like that.
Okay. Probably very hard to separate because you saw things at home. So you may have noticed more at work than other people did because you knew it was also happening at home. Can
Correct.
you think of other things that he was doing at work that you said, not eating lunch with people anymore and a little bit more moody? Were there other things? Obviously, he was still performing because the other CNRA, CR, you know
Yes.
what I'm saying.
Mhm. Yeah.
Yeah, was reviewing charts and everything was looking fine. So he was performing from that perspective. But is there anything else that you can remember that you noticed?
Yes, he would disappear a lot. He would just, one minute he was in the center core and the break room, and then no one could find him. Everyone's calling him overhead, and he's nowhere to be found. He wasn't taking a lot of breaks, so he was always breaking people, but didn't want to take any breaks. He wanted to do multiple cases back to back. He wanted to come in early, stay late. He was, at people on the surface, you see that as, wow, this is a high performer. He wants to work. He wants to take my vacation, and he wants to pick up shifts. And I want to go home to my kids, and he wants to stay and finish all the cases at the end of the day. Most people don't want to do that because they want to get home to their families. So his priorities had changed. And I noticed it right away that something's off here. He enjoyed going home, wanted to get out at 3 o'clock, 4 o'clock. And now it's 5, 6, 7 o'clock, and he's still hanging around wanting to do any emergency case that would come through. So those are a lot of the things that some people would see as, wow, this guy is a high performer. But on the other side, that's also a red flag, because he was going above and beyond to the point where he was compromising his physical and mental health. And sometimes we see that as, hey, he's a good performer. But again, he was just really not taking care of himself. It was obvious to me.
Yeah, absolutely. You're right. So those are some key warning indicators for everybody out there to keep an eye on and to listen for. I had a case recently, and that was the response from the supervisors and the physicians, like, oh no, she's aggressive in a good way. She always wants the difficult cases. She has no problem taking extra cases. And for them, yes, it was good. For me, it was warning bells were just like screaming in my head, right? Okay, what would you say the culture was at the hospital at the time? I mean, you felt comfortable going to another colleague, and then you mentioned that you went to his supervisor. Was that something that was it because you had a close relationship with those people and you felt comfortable that it would be in confidence? I mean, what were your thoughts as to where is this going to go and what could this mean for me, my husband, my family, his career?
So I felt, the culture in the OR where we worked, I felt like it was more like a family culture. Everybody cared about everyone, and we were all very close. We were a small department. We only had 6 ORs, so we were small. And I confided in his friend because I did trust her. I confided in the director because I trusted him, and I felt like I did trust everyone in the facility. That I didn't feel like I couldn't say something to someone and something would blow up. I felt very comfortable. And where did I see it going? I didn't know at the time. There's a lot of confusion. And when you start suspecting your loved one and your colleague at the same time, this colleague that you love is doing something that's hurting themselves, you don't know what to do. And I think at the time I was just reaching out with hopes that they would be able to do something that I couldn't do, because I had a very interesting, unique perspective and relationship with him, that sometimes you're being the nagging wife, or you're complaining about little things, and they could see things differently because they didn't live with him. So I went to them hoping that maybe something different would happen. A few times I said something to Rigo. I said, look, something's going on. Are you okay? Every time, of course, someone in active addiction, they're in denial. It's not an easy thing for them to talk about. So he never admitted to it in the beginning. He denied and denied. And, I thought, well, maybe he'd open up to a friend or a colleague. And no, I mean, that didn't happen, unfortunately.
Yeah. Did they confront him? You said they reviewed charts. Did they sit him down, have a conversation? Was there any detailed audit done on anything at all?
Not
No.
that I know of, no. No. Yeah, I know his friend did speak to him. And again, he kind of used, he was so sick that he was playing us against each other. Oh, she's saying this and she's saying this. And then we were both like questioning, did you say that? When some of the things, I don't think we said some of the things, but
Right.
I think there was a lot of manipulation, but that's so common when someone's in the throes of an addiction.
Right. So looking back, is there something that you recognize that you could have done differently that maybe would have gotten to the heart of the matter sooner, or any lessons learned that you would like people to know?
Oh, absolutely. In hindsight, of course, I look back, and I think back, with everything we went through, and had I known then what I know today, I would have absolutely done things differently. There's no reason I wouldn't have waited a day, not even 24 hours. I would have. See, I think a lot of us are not familiar with some of the regulations and the alternative monitoring programs in each state. Most of our states do have an alternative program, and these programs are there to help people in situations like this. So had I known about the alternative to discipline program, which in Indiana, it's called the Indiana Professionals Recovery Program, I would have called them and I would have said, hey, my name is so-and-so. I'm concerned about my colleague. This is what I'm suspecting. And then give it to someone. And they would have opened up an investigation and they would have called the employer. And yeah, he probably would have gotten in some trouble, but these programs are there to help people. They're not there to throw people in jail or to hurt people. So I think a lot of us are scared to report our colleagues because we don't know what those ramifications are. And we also don't know if what if we're wrong. And I will tell you, in the past, in my experience, some people have been wrong. Someone's just a really bad charter and they're not charting their medication, and all of a sudden they're being investigated or they have to go for a comprehensive assessment. But then they find out, you know what, at the end of all that, you're just a bad charter. You're not someone using drugs, which, I'll tell you, as a professional and as a nurse, if someone suspected me and pulled me in and said, hey, we have to do a hair test, we have to do a drug test, we want to do an assessment, and I know that I'm innocent, I would say, okay, if I didn't chart my meds, I get it. It's procedural, do it. So I think when people get defensive, sometimes I do feel that, I know there's a violation, you feel invaded, but at the end of the day, there are so many people struggling that, you have to do what's right. And, so I think I would have sought out some professional help versus going to just a friend or a colleague. And, after I got my response from the director that he was fine, I probably would have called and done more and had the professionals come in and intervene because they would have known what to do.
That's an interesting perspective. Yeah, I've been hearing that more and more lately, that it's very important to make sure that staff know what resources are out there. Because, I think we know, okay, the Board of Nursing has a program and they'll work with you, but it seems that information is really not enough information for people to feel comfortable with that. And do you have any suggestions on how to get that word out to people? Is it just part of the new employee orientation and their annual modules that they have to do, like specifics, or how detailed do you think that message needs to be in your state, how to get help for the different disciplines?
I do believe that during new hires and orientation, that would be a really good time to do it. And also, if you did annual competencies, as a nurse, the hospitals have requirements and we have to do these training modules every year, that if you keep hearing it and you keep seeing it and you give our staff and you empower staff to help their colleagues, and maybe it's reporting or, knowing the protocol. Because I think that was probably the hardest. My challenge was, I don't even know the protocol, the chain of command. Who do I call? And I think had I known, hey, this is how someone can get help, this is who you call. Maybe it's you call your HR and the HR will intervene, pull them out of work, do a drug test, call the monitoring program. I think had I known that there was an algorithm, I think I would have, I mean, absolutely I would have done it. But I honestly at the time didn't know anything about it.
Yeah, that's a good point too, because I think we feel like just naturally we would go to the supervisor. But then if it ends at the supervisor and nothing is done about it,
Yeah.
then, and then most of the time the supervisors are biased as well. So that's an interesting thought, is perhaps the protocol, obviously, if it, go to the supervisor, but everyone needs to know this is how you escalate if they don't give you the action that you think is necessary for the good of this person, right?
Yes.
So you have taken your experiences and you are now a certified addiction, drug, and alcohol counselor and a licensed addiction counselor. You and Rigo have started the Parkdale Center, which is a recovery center for healthcare professionals. And you're really taking that experience that you've had together and you're doing something very positive with it, which I think is a really great thing. Is there anything that you want to share additional to people out there that are maybe observing something, or those of us that are in the arena where I am, where we're kind of in charge of investigating and monitoring just the data? I mean, we're not working with the people, we see the data. Any suggestions that you would give us as to how to approach things?
Sure. I think the big thing is just knowing that, if someone's in trouble, we owe it to them and ourselves to try to get this person help. And as difficult and as challenging as it could be, there's a way out. And I think a lot of people, especially when you love your coworkers, sometimes you spend more time with your coworkers than you do with your own families. So we develop these really healthy connections and we love our colleagues and our friends and we don't want to see anybody get in trouble. But at the end of the day, it's about, wellness, and it's about taking care of our colleagues and being in this together. So absolutely. I think if you can walk away with anything today, is there's help for people. And I've seen some great success stories that just because someone's in trouble, it doesn't mean that they can't get their life back.
That's great. That's a great message. All right. Thank you, Claudia, very much for your time today. I've enjoyed having you.
Well, thank you so much. Have a great day.
You too.